Hi, if this is your first time being here, my name is Benedicta. So today I'll be discussing something that is very, very dear to my heart, which is fibroids. Yeah. For those that are just meeting me for the first time, I can say that I'm a fibroid survivor in the sense that I had fibroid, I got pregnant, I had two babies. Like his whole long story, I'm gonna be discussing that in a get to know me section. So now today we'll be discussing if you're trying for a baby with fibroid, what should you be aware of? What you need to know if you're trying to have a baby and you have fibroids already. There are certain things that doctors do not tell you. They tell you, oh, it's safe for you, the location is safe, but there is, I like to say, nitty gritty. There are certain parts of information that I feel like is usually left out that you should know, being the one that wants to get pregnant. So, because I do not want you to walk this journey alone, I have decided to bring this up to discuss, right? So, the question is are you trying to have a baby? Have you been diagnosed with fibroids? If the answer is yes, then let's get straight into it, right? So before we get into it, I've already asked one question. Have you been diagnosed with fibroids and are you trying to get pregnant? That's one of the questions, right? And then the other one is the question. Now I'll be answering the question that people usually ask is, can I get pregnant with fibroid? Can I get pregnant with fibroid? So if that is you today, you're here, you're asking, oh, can I get pregnant with fibroid? The answer is yes. You can get pregnant with fibroid definitely. Having fibroid does not automatically mean that you cannot get pregnant. Having fibroid does not automatically mean that you cannot get pregnant. And the truth is, I'm trying to emphasize on it because so many of us will be misled. So many of us just assume that because we have fibroid, that automatically means that we cannot get pregnant. So I am here telling you that I've had fibroid. I always had fibroid, and I have two babies now. So having fibroid does not automatically mean that you cannot get pregnant. And the truth is, some women they may hear the word fibroid and then they get surprised and then they're like, "Oh, does that mean like the first thing that comes to mind is oh I cannot have babies?" But anyways, I feel you because I've been there before where I was actually like, oh, I cannot have babies, because when I found that I had fibroid, I just had this relationship that was really, really interesting. And we're already talking ring size and everything. And I was into him and he was into me. And boom, I think it was shortly after we had discussed that we wanted to have kids. And boom, I found that I had fibroid. It was very it was very funny because the first thing I was thinking was, oh, this guy's gonna break up with me now before because I have fibroid. So if you're here and you're in so and in a if you're here and you're in a relationship and you're thinking, oh, this person's gonna break up with me because I have fibroid, I'll not be able to give birth to a child. I want you to hold on your thoughts because that's not gonna happen to you because you're gonna have a baby. As a matter of fact, you're gonna have as much baby as you want, right? So now, yeah, having fibroid does not mean that you're going to be infertile. So I just thought I should let you know that. And please, if you have any question, please leave it in the comment section because I want this to be as interactive as possible. I want you to ask all the questions that you think that you can ask even while we are live, and then we'll like go through the questions and just really get you to a place where you have an understanding to look after yourself, right? So now, if you have fibroid, you can become pregnant and you can have a child. Fibroid and infertility are not automatically the same thing, right? There are so many reasons why a woman would have fertility struggle. It's not necessarily because of fibroid. So if you're trying to get pregnant and you have fibroid, instead of assuming that is the fibroid that is stopping you from getting pregnant, it might be a good thing for you to go and check out the reason why you are not getting pregnant so they know that okay, this is not the reason, right? So some women have fibroid and they conceive naturally without any major problem, whereas some people they have fibroid and fibroid can contribute to their fertility problem. The difference is very important. The difference is what we'll be discussing right now. Why some people can go ahead and have successful pregnancy journey, and some people can have a bit of hiccup in trying to get pregnant or trying to keep their pregnancy because they have fibroid. So the question that I will be answering, the first question, the ones I've actually had that people have asked me before, is why do some women with fibroid have problems getting pregnant? Why do some women with fibroid have problem getting pregnant? So if you're here and this is your question, I have answer, right? So some women have fibroid and get pregnant easily, while others they kind of struggle a bit before they get pregnant, right? One of the biggest thing that we need to look at is where the fibroid is located. That's the most important thing. So after you've been told that you have fibroid, the next thing that you should be learning is the location of your fibroid, because that actually determines how the fibroid is going to affect your life and in what way the fibroid is going to affect your life. So the first thing is, yeah, you already know that you have fibroid. So now what, right? You should be asking your doctor what is the location of the fibroid, or where is the fibroid located at. Not just how many fibroids you have, because I know that most of us we tend to ask how many fibroids we have, and some of us we don't even ask. The sonographer just voluntarily tell us that, oh, you have multiple fibroid, but the number of fibroid is not as important, it's not as important as the location of the fibroid if you're just finding out that you have fibroid for the first time, right? And then knowing how big they are too is not as important as the location. I know that you need to know how big they are, the number of fibroid, but the truth is the most important thing that you should be asking is where is the fibroid sitting? Because it's the location of the fibroid that will determine whether or not you're going to have a successful pregnancy. Is not necessarily the size nor the numbers of the fibroid, if that makes sense, right? So, for example, some fibroid can grow into the cavity of the uterus womb, can grow into the cavity of the womb, while other fibroid can grow around the muscular wall of the womb, while others can grow outside the womb. You see? So it's three different locations. Some grow inside the womb where the baby stays. Some grows around the womb, while some grow outside of the womb. You see why it is very important for you to know exactly where your fibroid is located. The location can matter when you are trying to get pregnant. If you're not trying to get pregnant, it may not necessarily concern you, like this topic that we're discussing now, because of course you're not trying to get pregnant. But if you know you want to get pregnant in the future, it's a very good thing for you to ask where the location of the fibroid is, right? So if you have been diagnosed with fibroid, instead of asking how big is your fibroid, you shouldn't be concerned about the size, because the size does not do as much bad as the, sorry, this is my first time coming live here, by the way. So if you see me looking around, it's because I'm trying to see if I'm still live, right? So the size does not, it's not as bad as the location, if that makes sense. So where exactly is my fibroid is a question that you should be asking when you're told that you have fibroid, right? It is very, very important. That's an important question you should ask your doctor. And then the next question is, do all fibroid need to be removed before pregnancy? See, I'm Nigerian, and I'm sure you can tell from my accent, right? I'm originally from Nigeria, even though I don't live in Nigeria at the moment. But where I come from, most of the time, girls, even the ones that are not ready to get pregnant yet, as soon as they find out that they have fibroid, I mean, like the fibroid that is not causing them pain or something, just I think it's just knowing that let me turn on this light. I think it's just knowing that they have fibroid. The first question or the first thing that they get told is, oh, just go and do fibroid surgery so that you can get pregnant immediately. The reason why I do not like such statements is because after you have had your fibroid surgery, you're meant to wait at least 6 months before you get pregnant. After you have had your fibroid surgery, you're supposed to wait 6 months before you get pregnant. So, for the people saying just go and have your fibroid surgery so you can get pregnant immediately, is actually a wrong medical advice. And obviously, the people that are saying this, they are not medically inclined, if you ask me, right? Because I had my fibroid surgery about 7 months ago now, and the first thing I got told was do not get pregnant until after 6 months. The reason is that the fibroid is in your womb, right? So they've gone in there, they've done stuff to it. You need time for it to heal before you can even think of getting pregnant again. It's just like somebody that has had CX getting pregnant within 6 months after you. I know, like, you might say that it's not the same thing, but we are talking womb because it's not physical, it's not something we see. We cannot tell if it has healed enough or not. But medically, they are able to estimate the amount of time it would take for it to be healed enough. Right, so that is why they will say after your fibroid surgery, do not get pregnant within the first 6 months. So you see why it is wrong for somebody to just have fibroid and assume that they have to do a surgery. Because if the reason for you doing the surgery is because you want to get pregnant, like, you still need 6 months, so that's not technically right. Again, the question is, do all fibroid need to be removed before pregnancy? No. I think you should have figured it out from all the things I have said. All fibroids do not need to be removed before you get pregnant. If the fibroid is not causing you complications like affecting your day-to-day life, leave it. The best person to be asking this question is your doctor, because your doctor is going to confirm physical examination to confirm that you have fibroid or some sort of growth, and then they are going to send you to for ultrasound scan, at least to confirm the location and the size of the fibroid and the type of fibroid that you have, right? And after they've done that, they cannot decide whether or not you need surgery. And that's the reason why they usually do fibroid surgery, is more for the symptom of the fibroid, not because you're trying to get pregnant, right? So if the fibroid is causing you symptom, or if you have had a baby before and there was complications when you were trying to give birth to your child due to fibroid surgery, then they may advise you to do sorry, due to giving birth, if you have complication be when you were giving birth, they may advise you to do surgery before you have the next child. So again, it's usually fibroid surgery is suggested due to complications that you're having because of fibroid, not necessarily because you want to get pregnant. So it's not every woman that has fibroid that needs it removed before you get pregnant. The decision is yours to decide whether or not you want to remove it before you get pregnant. And again, you have to run it by your doctor, right? So your doctor may consider the size. If they are discussing surgery for you for the fibroid, they may consider the number, and then they may consider the location as well. So whether the fibroid is affecting the cavity of the womb, that will be considered. Whether you are having symptoms like it's affecting your daily life, especially during the months when you're having your period, that will be considered as well. And then if you have had previous pregnancy history, like I said, maybe you had a baby and it has some sort of complications because of fibroid, that will be considered as well. So again, have the conversation with your doctor and let them know what your thoughts are. And to be honest, doctors, they are trained to do this. They have the right answers for that question. Now, the next question that some people will be asking is, what if I am already pregnant? maybe before you got pregnant, you didn't realize that you have fibroid. Now you're pregnant, you just found out that you have fibroids. If that is the case, do not panic. Yeah, do not panic, because I have successful pregnancies with fibroid intact. So do not panic. Do not panic. Again, having fibroid doesn't automatically mean that you're going to have a bad pregnancy experience. As a matter of fact, my cousin didn't know that she had fibroid until the day she was having the baby. And the reason why they knew is because she had the baby through a cesarean section. So she had a baby through CX. So while they were taking out the baby, they realized that she has some fibroid growth in there. So that's to tell you that you can go on to have a very successful pregnancy without even knowing or even noticing that you have fibroid, if that makes sense. So again, by the time you find out that you have fibroids, you need to have the conversation with your healthcare team, because they are going to consider the size of the fibroid, the location of the fibroid, and again, that will determine what sort of care you will need during your pregnancy journey. But you need to be talking to a gynecologist, because gynecologists, they know what they are doing, so they'll be telling you exactly what sort of care you need. You'll be needing more appointment that you would have gotten if you didn't have fibroid, because having fibroid automatically just brings your pregnancy journey to a high risk journey, right? It's considered as high risk pregnancy once you have fibroid. So they have special guidelines to actually look after you. They have plans in place to make sure that you are well taken care of during your pregnancy journey. So the truth is, you need to get as much information as possible. That's why I'm doing this video. And then you need to talk to your healthcare provider as well, because the more information you get with regards to your pregnancy journey and everything, the lesser you fear. Does that make sense? So if you have enough information, you'll be able to make informed decisions, and then that reduces the fear that you would have. So you definitely need all of those information, because it's when you have lack of information about certain things that's what creates fear. And then the question that people keep asking again is, can fibroid grow during pregnancy? This is a very common question. And then I had this question before I got pregnant. And I wish that I actually asked it, because the time I had the questions, it was all in my head. Because I was just told when I found that I had fibroid, it was about 4 millimeters. So it wasn't big. The biggest one was 4 millimeter, and then the second one was about 2 millimeters. So it was like really, really tiny. Both of them I knew I had to way before I got pregnant. But to answer the question, can fibroid grow during pregnancy? The answer is yes, it could grow. And then there's another part to it where fibroid can degenerate when you're pregnant as well. So for me, my fibroid grew while I was pregnant, because he grew from 4 millimeter up to 10 centimeter. The biggest one at the time I was having my child, my first child, was about 10 centimeter. And I know that I had about 4 5 before the end of the pregnancy. So which means that some grew more. There were more fibroids that grew during the time of the pregnancy journey, right? So and yeah, fibroid can grow while you're pregnant, and then there can be degeneration of fibroid, which is like the fibroid will stop growing, and at some point it will have to come out while you're pregnant. And the only way it can come out is through bleeding. Yeah. So every woman's experience is different. So don't go about comparing yourself to another person. I know I've said, oh, they can grow, but that does not necessarily mean that your own fibroid will grow. Like I said, my cousin, she was pregnant, she had fibroid, the thing didn't change in shape, it didn't change in size, it didn't give her any complication. She didn't even know that she had it until the day she was having her baby. So again, it's not, when it comes to women's health, it's not a one size fits all. Different strokes, different folks, different folks, different stroke. Anyway, you get what I mean. So it's not a one size fits all. It's just whatever comes comes. And may I say that when it comes to pregnancy and having fibroid while you're pregnant, different pregnancy comes with different stories as well. Like when I was pregnant with my first boy, there was loads of like complications and all of that. When I was pregnant with my second boy, I didn't necessarily have complications during the pregnancy journey, right? So again, it differs from one pregnancy to the other, and as well as from one woman to the other. So don't leave here and start thinking that, oh, because this doesn't happen to that woman that way, it shouldn't happen to you that way, or because this is happening to the other person this way, that's how it should happen to you. It's two different ball game, right? So now the other question that people keep asking is, can fibroid cause miscarriage? See, honestly speaking, this is a bit sensitive because fibroids, I don't know how to say this because I have experienced miscarriages, to be precise, and I had fibroid. For the longest of time, I thought that it was fibroid that caused it, but the truth is it wasn't. It wasn't. It was something else that was causing the miscarriages. So the answer is certain fibroid, particularly depending on their location, may be associated with increased risk of miscarriage. It does not necessarily cause miscarriage, but it could put you at a higher risk of having a miscarriage, right? Because even when you go for your antenatal care, once you let them know, you let your healthcare provider know that you have fibroid, they are going to tell you this, that there is higher risk of having miscarriage because you have fibroid, depending again on the location. Because if the fibroid is located in a place where the baby is actually implanted, right? And the fibroid is growing, the baby is growing. So it can restrict the baby's growth in some ways. And we don't know how that would happen. However, if you've had miscarriage before, I would like to say that do not just assume that it was the fibroid that caused it. The reason is because I had miscarriage. Mine was caused by low progesterone. It wasn't fibroid. And I'm glad that I didn't just stay and assume that it was fibroid because I would have not gotten the help that I needed. So what I'm trying to say is, if you're pregnant and you have fibroids and you've had miscarriage, I'm so sorry, but you need to let your healthcare provider know that you need further testing just to rule out all that cause of, you get, yeah, instead of just assuming that that is what is causing this, right? So if you've had miscarriage before, you cannot automatically conclude that it's the fibroid, even though having fibroid increases your chance of having miscarriage. But there are so many reasons why miscarriage can happen as well that is not related to fibroid. So if you have experienced miscarriage, like I said, speak to your healthcare provider and do further testing, right? Yeah, because I just made this conversation a little personal, right? Because sometimes we may hear statistics. You hear that, okay, this, we have so many people, like nearly 80% of black women, Asian people, they are going to have fibroid in their lifetime. But if we do not see the person that is actually experiencing it personally, we may not be able to relate. So that's why I'm here sharing my story so that you do not walk this journey alone, because I know how lonely it can be. I'm the only one amongst my friend that has fibroids, and as much as they love me and they wanted to be there for me during my pregnancy, they cared for me, but they sometimes they didn't know how to, because of course they've never walked the road. So the best person to actually be on a journey with you is a person that has been there before. So it's easier because you're both not navigating the journey at the same time. Somebody has gone ahead with the experience, they can now bring you along with them. So that's why I may be personal with this right now, because some of you, so women may be so scared after they've heard that they have fiber. And to be honest, if you're scared, that's very valid. I was scared too, right? That's very valid. It's valid for you to be scared. It makes sense. If you're not scared, then I will be worried, if I'm being honest with you. And then some people, so women may be trying to conceive and then they are wondering, oh, how does this affect my trying to conceive season again? That's why I'm sharing this so that you know that you can have fibroid and still have successful pregnancy and you'll be fine, you'll be all right. And then some women may feel that they have lost pregnancy due to fibroid. Me, I would say that don't rule that out here. Don't just conclude that it's due to fibroids without actually doing a further testing to find out the reason why you actually had that fibroid. Because, like I said, there are other factors that can lead to you having fibroid, not necessarily. Other factors that can lead to you having um what's the word, having miscarriage, not necessarily fibroid, right? Because I had multiple miscarriage back to back, but it wasn't caused by fibroid anyway. So, and I think the most important thing is I don't want you to leave here to start googling everything. Mm-mm. I want you to leave here, and if you have more questions, go to your doctor and ask your doctor questions. That is why they are there for you. So, the other questions that people keep asking is, can I have a vaginal birth with fibroid? The answer is yes, you can. I get why people want to know, okay, can this happen? Can I have a vaginal birth with fibroid? I get it. Because you would think that it's easier for you to have a cesarean section because of fibroid. The truth is, having a cesarean section when you're pregnant with fibroid is way more complicated than having a vaginal birth with fibroids. That's what my consultant said, and that's true. The reason is because fibroid surgery is major, and the the CS is a major surgery. So it's like you having two major surgery on a very, very vulnerable place, right? Because you've carried your baby for how long in this same space, and the place now is lapsed and he just needs to rest, and then you're having a double major surgery. Bearing in mind that you still have to go home and look after this child or children that have just been taken out. And another thing that people fear or doctors fear is sometimes if they are trying to cut through this, they don't want to cut through the fibroids because it can lead to something that unprepared for. I don't know what I can say and what I cannot say on this platform. That's I'm trying to like pick my words and it looks like I'm just everywhere. Right. So again, when you have fibroids, you can give birth vaginally as long as the position of the baby and the fibroid permits it, because again they want to make sure that the fibroid is not in the passageway of the baby, so it's not stopping the baby from coming out. That's very important. That is why once you know that you have fibroid and you discover your healthcare provider, they are going to put you on regular antenatal appointments. So please do everything within your power to attend that appointment because it means a lot. I remember when I was pregnant with my first boy, from my third trimester, I was literally in and out of the hospital every 2 weeks for a scan because they needed to keep an eye on the growth of the baby as well as the growth of the fibroid because it kept growing rapidly. My baby was growing in one end, and then the fibroid was growing at the other end, and the fibroids were increasing in numbers and in sizes. So they wanted to keep an eye on it. So every appointment that you're giving while you have fibroid, please take it seriously. Because what that does is it gives them room to foresee what's going to happen and make adequate plan in order to prevent things from happening. Because I'm glad that they did that appointment for me, because even before I had my first boy, before the induction they had already put up like transfusion stuff just in case I would need it, because they know that that could be one of the complications of fibroids. You see why it is very important to go to the right healthcare system where they understand being pregnant with fibroids, because they are going to put things in place that is going to help. So again, like I said, whether or not you can give birth vaginally, it depends on certain factors, right? It depends on the location of the fibroid, it depends on the location of the baby, because if your baby is transverse, if it's breached, right, they're not going to advise you to give birth naturally, right? But if the baby is head down, they're going to advise you to give birth naturally, regardless of the number of the fibroid, especially if the fibroid is not standing in the way of the baby coming out, right? So, if you're asking that question honestly, I understand. Now, my question is, if you have watched this for this long, thank you for being here. And please do give us a follow, because on this platform, I am sharing my personal experience and sharing the other things that I find online and on medical journal and dictionaries, so that we can both walk this journey together, because there are so many things I didn't have answers to before I had my babies that I now have answers to. And in fairness, I've had my own fair share of hormonal struggle. I had fibroids while I was giving birth to my two boys. I had PPH. I had manual removal of placenta. Like, I have seen it. I can say I've seen it all, but God, I don't know. But I've seen a lot when it comes to women's health, right? So this is me sharing my journey so that you too can know that okay, somebody has been there before. So if you have any question, please ask. And the only way to find out when I upload stuff, the only way to participate or to ask me questions by following. Please, I am new here again. I know maybe you have not noticed it, but if you notice, I am very, very new here. Not like new, but like this is my first live, by the way. So you have to rate me. How did I do? Did I do well? Did the live go well? Or what area do I have to improve on? I'm very open to learning, because I want to serve you right. I want to serve you right. So please do where to follow and turn on the notification button, so that when I put up anything, you'll be able to see, so that you too, when you ask me question, I'll be able to see it in the comment section. Now, my question for you today is, honestly, I want this to be as interactive as possible. A time will come, if as soon as I learn to do this, I'll be adding people to the stream so that we can all have this conversation together. So the question, if you don't mind, you can leave this in the comment section, your answer. If you have fibroid, what is your biggest fear right now? If you have been diagnosed, you have been told that okay, you have fibroid, what is your biggest fear? Let us hear it. Because that thing you think is a mountain might just be the difference between that thing you think is like a mountain, could just be that you lack the right information. That's why it looks so big. So what's your biggest fear? Is it getting pregnant? Are you thinking, oh, you cannot get pregnant because you have fibroids? Is it getting pregnant? Is it losing the pregnancy? Are you worried that that's going to affect the journey of your pregnancy? Are you worried that the fibroid is going to grow while you're pregnant? Or the fibroid is going to shrink and it could cause complications during pregnancy? Or are you worried about giving birth? Like, you don't know, okay, what's going to happen? Or are you worried about having surgery? Is it about surgery, like having CS, or maybe having fibroid surgery before you give birth or after you have given birth? So again, what is your fear right now? Let's break it down. Let's discuss it. Because honestly, sometimes the question you are afraid to ask is the question another woman is sitting in at home wondering, oh, what is this? Because I remember when I was pregnant around 2021, I remember how much I came online on YouTube trying to find answers to what was wrong. Because I just knew that, okay, this miscarriages could not be caused by fibroids. So, excuse me, what is the other reason? Why am I losing my baby? You understand? So yeah. So again, if you have questions, please ask. And that brings us to the next one, questions that you should be asking your doctors. Yeah. You thought I wasn't going to go in there. I would, because I need you to have conversation with your healthcare providers, because now you know what is more important. You already know that the location of the fibroid matters more than the size or the numbers. So now, what is the question that you should be asking your doctor? Because if you're trying to get pregnant, you're trying to conceive, and you've been diagnosed with fibroids, some of the questions that I would be asking if I were you is, where exactly are my fibroid located? Is very important. How many fibroid do I have? That's equally as important, but not as important as where it is located. And your next important question is, how large are they? How big are my fibroid? Are they affecting the cavity of my womb? You need to ask that. And if you do not know what cavity is, ask your doctor. Is it inside my womb or outside the womb or surrounding the womb? Ask that question. The next question is, do you recommend treatment before I conceive? Because in my case, I wanted to actually do a fibroid surgery, but my consultant said I didn't need it. My doctor said I didn't need it because it wasn't stopping me from getting pregnant. So again, ask this question. Do not just assume that you need surgery because you have been diagnosed with fibroid and then you go ahead and have surgery. No, don't do that. And then another question you should be asking your doctor is, how does this fibroid affect my fertility? You should ask the question. And the next question is, if I become pregnant, will I need additional monitoring? As a matter of fact, I will answer this yes. So even if your doctor is saying you may not need, sis, I would need, because when I was pregnant with my boy, I already knew I had fibroid, right? And my fibroid, the biggest one was 4 millimeter. It was very small. And the thing is, my fibroid was accidental finding. What that means is, I didn't know I had fibroid. I had symptom, but I was comparing my symptom to other people's symptom, and it didn't match up, right? So I would say I didn't know that I had fibroid. I went for general checkup and then I found out. So when you find out things like that, they don't do anything about it, because first, it's not giving you any grief, it's not giving you any stress, right? It wasn't affecting my day-to-day life or anything. I was just always fatigued, but again, that's part of growing up. So I thought, right? So they didn't do anything about it. They didn't do anything about it. They were just like, okay, you're fine, da 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 da. And that was what happened. But when I got pregnant, I started to experience pain. I was in excruciating pain, if I'm being honest. Every day of the pregnancy, I would take paracetamol because that's all I was allowed to, right? So I had to book for an ultrasound scan because I called the hospital. They said, "Oh, I already done the, when you're pregnant, you do the dating scan first." So ideally, when you're pregnant, you only need two ultrasound scan. In the country where I gave birth, which was in Ireland, right? You only need two ultrasound scan during your pregnancy journey. Your dating scan to confirm that you're pregnant, is in the right location, and the date you said your first day of last period tallies with was on the screen. That will enable them to give you your EDD, your estimated due date. And then the next scan you would have is 20 week, which is anomaly scan. That usually will scan for any deformity or if the baby is growing all right. That's what that you need ideally. But after I've done my dating scan, which is usually done before 12 weeks, basically, or maximum at 12 weeks, I think I did mine earlier. That's because I've had two miscarriages by this time. At the beginning of the pregnancy, I was bleeding. So I had two scans. I had the first one to confirm that I was actually pregnant for them to put me on medication. And then I had another scan to confirm that, okay, the medication was working and the baby was growing. So at this stage, I'd already had two scans. So they said I didn't need any other scan because I was like, oh, I'm in pain. Can I have scan? They're like, oh, no, you didn't need any other scan. And what I did was I paid at 15 weeks pregnant. The day I actually turned 15-week pregnant, I went to a private ultrasound diagnostic center and did a scan. That was when I realized that the fibroid has grew. I think at this stage they were already like in their 5 centimeter already. They were like 5 centimeter, 7 centimeter. I think there was 8 centimeter at this stage, and they've increased the numbers as well. So that was not the result I brought to the hospital. 'Cause I had to call the hospital. I'm like, you know what? This is what I am experiencing, and I have done a scan to confirm this. So as soon as they saw that, so they brought me in, and then that's when they started to do close monitoring. So it now became like very high risk pregnancy. So the reason why I said that is because whether or not the doctor thinks that you need extra monitoring, you should insist. If you can afford it, get as much monitoring as possible. Because during my third trimester of the pregnancy, even in my second trimester, I think I did extra 2 scans because there was one time I had a bleed and then another thing happened. But in my third trimester, I was having ultrasound scan every 2 weeks of the pregnancy, every 2 weeks of that pregnancy, because they needed to keep an eye on the growth of the baby and then the growth of the fibroids so that they can plan when I would have the baby. So again, you need to ask your doctor that if you get pregnant, would you be needing extra monitoring? They would tell you. So another thing is if you have had previous miscarriage before, I am so sorry to hear that. Or if you're pregnant, like if you did assisted reproductive pathway, more like IVF, if you did IVF, assisted reproductive treatments like IVF, or if you have experienced a complicated pregnancy before, make sure you tell your doctor, especially if you're changing doctor. The reason is because they need to know what your history is so that they can better care for you. So do not think that it is not relevant. It is very, very relevant. As a matter of fact, when I was going to have my second boy, they were measuring his weight and his height while he was in my womb, even after I gave birth to him, against his brother's measurements. And I was like, why are you doing that? They are two different individuals. And then they told me that if he was way bigger than the brother, then there's a problem. And if he was way smaller, then there's a problem. So the brother is like the landmark because he's my first child. So it means that every other child that I would ever have, their weight and height will be measured against him. Does that make sense? So do not think that some information does not matter. They don't need it. They need all the information because it would help them to care for you better. So you have to mention it. So another thing is myth busting. So there are some people, yeah, they are not sure what is real or what they should believe because there's so many myths out there that can pass for true. But I like to say that the reason why they call certain things myth is because there has not been enough medical research done on it to say, okay, this is valid, right? So things like that, they just said it's myth. Anyway, so let's do a quick myth busting. So let's do a quick myth busting, right? So maybe we should leave this. Next time we'll do it. So next time, please, when I come live, let's be live together because this will actually make sense if we're all live together so we can. Yeah. Anyway, I'm gonna leave it here because I've spent nearly an hour here. Thank you for being here. Please do where to follow, follow, subscribe, follow. See, I'm new here. Please be nice to me. Be nice to me. You need to encourage me. You need to say, "Oh, well done, girl, for what you did." And the way you can do that is by following me. by liking me, by just turn on your notification just in case I post something next. And if you have any question that you want me to talk about, any topic, please let me know. And again, I am all round all weather. So in this place, I'll be showing my true character. I'm sure some people on the other platform will be wondering, oh, is this how this girl really is? Yes, this is how I am. This is my true character. So I promise, I pledge to show my true character on this platform. So help me God. I'll see you guys. Bye, guys.